Welcome to How Can eHealth Technology Help Your Mental Health? Mental health has always been a topic of interest to me, and I always thought my mental health was intact. Then, 6 years ago, after the death of a prominent family member, I was diagnosed with general anxiety disorder. I won't go through all the details, but I was put on a treatment plan and I got better. In my current role at Central Carolina Technical College, I also work in a department that focuses on mental health. So this is a topic of great concern to me. The term mental health has become a household word in the past 10 to 20 years, and more so during and after the COVID pandemic. But the phrase mental hygiene was first coined in 1843 by William Sweetser. The concept of mental health that we have today came about by the mental health movement in 1908. But what is mental health? It affects our psychological, emotional, and social well-being, and it affects how we think, feel, and act. It also determines our capability for handling stress, how we relate to others, the choices we make and whether they are healthy choices or not, and how we perform our daily tasks or if we do at all. But this presentation is not just on mental health, but on telehealth. But what is telehealth? Simply put, it is the provision of healthcare by remote means through telecommunications. We can now talk to healthcare providers on the phone or through video chats. We can send and receive messages through secure emails, messaging, or file exchanges. Our health can be monitored through apps or virtual wellness checkups by our provider. And there are health-related podcasts and internet articles. We can look on websites for side effects to medications or join online support groups and connect with others going through similar situations. The benefits of telehealth are enhanced health record accessibility, medical data storage and record transfers, fewer medical errors, and access to timely and updated information. We also have access to our health information, which gives us a greater sense of control and responsibility and hopefully greater care over our health. The website dosomething.org lists 11 facts about mental health. For the sake of time, I have listed the top 5. More than 50 million Americans struggle with mental health and many lack access to adequate treatment. It is estimated that over 54% of adults diagnosed with mental health did not seek or receive treatment last year. Sadly, 1 in 5 teenagers ages 13 to 18 have or will develop a mental illness in their lifetime. And lastly, mental health conditions do not discriminate. Anyone can develop a mental illness at any point in their life. So where is mental health today? Telehealth and eHealth did not come about because of the COVID pandemic, but it was certainly pushed forward at a faster rate because of it. The term itself, eHealth, was coined in 1999 and is a term that encompasses our electronic medical records and electronic health records. These two terms are not interchangeable. Medical records stay within a practice or clinic and is used for your diagnosis and treatment. Health records are the records that move with you between different organizations to give an expanded view of your health. Common examples include when you visit an emergency room and then follow up with your doctor. They will have a record of that emergency visit. Another example is when your practitioner submits a prescription electronically to your pharmacy of choice. The benefits of this is that not only do doctors have access to our health, but we also have access to our health and we have more control over it. I know that I like to have control over my health. I can access my electronic records online with my patient portal, see the results of lab work, review treatment plans, read doctor's notes, and even pay my doctor's bills. In addition to accessing our electronic records, there are other technologies that help us monitor, control, and work on our mental health. While nothing quite replaces a face-to-face counseling or clinical session, we can now engage in virtual appointments. For people suffering with OCD, general anxiety, immune or communicable diseases, social anxieties, or anyone living in remote areas, it is not always feasible to go to the doctor. One thing that COVID pushed forward was the technology to have virtual visits. I was diagnosed with COVID in 2021, 5 months after starting a new job. At the time, it was 10 days quarantine still. My husband and daughter also had to isolate. I didn't feel well physically, I was worried about my job, and I felt guilty for my family being out of work. As a result, my anxiety spiked. But because of eHealth technology, I was able to log into my patient portal, type a message to my doctor, and by the next day, I had a video appointment. The medication I was on was a low dose, so he advised me to increase it to 30 milligrams a day versus the 15 I was taking. He was also able to prescribe an extra supply of medication in case I was running low. Then my pharmacy mailed it to me. Without this technology, I would have either have suffered in silence or self-prescribed and taken more medications without a doctor's okay, possibly resulting in an unhealthy dose. Another way we can monitor our health is through apps. There are cell phone apps for virtually every aspect of our lives, from banking to car insurance, from connecting to friends and playing games, and eHealth is no exception. Apps like Calm and Headspace aid in sleep, meditation, mental focus, and reducing stress or anxiety. The app Sanvelo helps users to cope with anxiety and depression, offers self-care tools, coaching, therapy, and peer support. The app Bearable tracks moods, health, and habits and offers insights, graphs, reminders, and goals. There is also wearable technological devices that monitor and collects our physical data like smartwatches, Fitbits, glucose, and blood pressure monitoring. Our physical health can be a direct result or a cause of our mental health. Through indirect means, by monitoring our physical health, we can maintain our mental health. What is the future of eHealth? We know that mental health can be linked to hormones and chemical changes in our body. Feeling sad is an emotion, but depression is a chemical imbalance in the brain. We already have biometric scanning for identification to unlock our phones, punch a time clock, or other means of identification. Will the future of eHealth become biometric scanning with AI or robotic doctors that can then diagnose our mental health? Digital signage is another area that uses biometric scanning to determine a person's demographics and tailor ads towards their age, race, or gender. Will biometrics evolve to the ability to diagnose a mental health condition and tailor ads towards those conditions? Will wearable monitors that are already checking on and alerting us to our physical health be able to evolve to electronic versions of the 1970s mood rings trend and let us know when a mental health condition is setting in? These may sound like science fiction, but with technological advances and with the current technology in eHealth, I foresee that mental health is not far behind. This is a list of references that I have used for this presentation. If you want to learn more about eHealth or mental health, I recommend these websites. However, if you think you are suffering from a mental health condition, it is important to call your regular medical provider immediately and set up an appointment. Thank you, and I hope you enjoyed this presentation.